What are indemnity health plans, and how do they pay you? Imagine having the freedom to see any doctor or go to any hospital you want without worrying about network restrictions. That's one of the main features of indemnity health plans. These plans are a type of health insurance that reimburses you for part of your medical expenses based on a fee-for-service model. Instead of limiting you to a specific list of providers, you can choose any healthcare professional you prefer. When you receive care, the provider bills you or your insurance company directly. The insurance then pays you a set percentage of what they consider the reasonable and customary charge for that service. This means if the doctor charges more than what the insurer deems fair, you might have to pay the difference, which can sometimes be a significant out-of-pocket expense. Indemnity plans work by reimbursing you after you pay for your care. You pay the provider, submit a claim if needed, and then the insurer reimburses you for a portion of the cost. The amount they pay is usually a fixed percentage, often around 70 to 80%, of the reasonable charge. You are responsible for the rest, which includes your deductible, co-insurance, and any charges above what the insurer considers reasonable. Because these plans do not restrict your provider choices, they are flexible but can sometimes lead to higher costs if providers bill more than the insurer's allowable amount. There's also a subtype called fixed indemnity plans. These are different because they pay you a predetermined cash amount for specific events like hospital stays or surgeries, regardless of the actual cost of care. For example, a fixed indemnity plan might pay you a set amount per day if you are hospitalized. These plans are often used as supplements to traditional insurance to help cover deductibles, co-pays, or non-medical costs during recovery. They do not replace comprehensive coverage and usually do not meet the standards of laws like the Affordable Care Act. It's important to note that while indemnity health plans offer great flexibility, they can also expose you to larger bills. Since providers are not contracted with the insurer, they might bill you for the difference between their charge and what the insurer pays, a practice known as balance billing. This can lead to unexpected costs, especially if the provider charges more than what the insurer considers reasonable. Many people use indemnity plans alongside traditional health insurance to help manage unexpected or high out-of-pocket expenses. They often come with affordable premiums and can be a good option if you want maximum provider choice. However, because they do not restrict provider options, you should be prepared for the possibility of higher costs and balance billing. In summary, indemnity health plans pay you by reimbursing a portion of your medical expenses based on a percentage of the reasonable charges or through fixed cash benefits for specific events. They give you the freedom to choose any healthcare provider but can sometimes lead to higher out-of-pocket costs if providers bill more than the insurer's allowable amount. Fixed indemnity plans offer cash payments for certain events but are limited in scope and meant to supplement, not replace, comprehensive health coverage. Always remember to review your options carefully and consult healthcare professionals to find the best plan suited to your needs.